Welcome to Medicine Handy Points. Today we will discuss an important topic which is sarcoidosis. Now let's start with the topic. It is a multi-system disorder characterized by non-caseating granuloma in many organs but mostly in lungs. It is commonly present in a young female patient. Uh, can occur in older as well, most commonly in young female. But TB has to be excluded either by sputum A, B, or ball, whatever method. But TB has to be excluded because skin tuberculin test is almost always negative in these patients, so we cannot rely on that. Now, to diagnose, we have a few things which we have to do. Chest X-ray is positive in 90% of the cases. We'll discuss the chest X-ray later on in the lecture, but 60% will be asymptomatic with abnormal chest X-ray. HRCT will just point out fibrosis in upper lobes, and definitive diagnosis is transbronchial biopsy, which will show non-caseatic granuloma in 90% of the cases. So it will be the biopsy which will give us the diagnosis. Now ACE is raised with 60% sensitivity and 70% specificity. So we cannot rely on ACE, and it has no diagnostic value because it is raised in other conditions like mildew, tuberculosis, lymphoma, liver diseases. So ACE is not diagnostic in sarcoidosis, but in neurosarcoidosis it has some value. ACE can be used to assess the response to steroids because produced by macrophages, and steroid suppresses the macrophages. ACE activity is more in lymph node sarcoidosis than in respiratory system. So, and sarcoidosis is most common in respiratory system. Calcium will be raised as granuloma. Non-caseating granuloma produces active form of vitamin D, so that will cause hypercalcemia. ESR will be also raised because it's a chronic condition. An important point which was missed: ACE in CSF can be diagnostic in neurosarcoidosis. That's an important point. So sarcoidosis stages on a chest X-ray. There are 4 stages of sarcoidosis on the chest X-ray. The stage 1 has just lymphadenopathy, stage 2 lymphadenopathy and infiltrate, stage 3 infiltrate mostly as you can see in the chest X-ray. At stage 5 there will be fibrosis. So these are the 4 stages of the sarcoidosis on the chest X-ray. Now treatment, they need treatment in 1/3 of the cases. 2/3 of the cases resolve without treatment. Mostly we give steroids for 12 months with a tapering within 1 more year. So within 2 years we should be on a minimum dose of steroids. Now steroid education sarcoidosis, hypercalcemia, we should give steroids. Eye, cardiac or neuro environment, we should give steroids. And another indication for steroid therapy is that worsening lung function. If the patient is deteriorating, developing shortness of breath, then we have to do steroids therapy. Now poor prognosis occur in patients with age more than 40. Number 2 is slow onset of disease with the symptoms more than 6 months. So slow disease, absence of erythema nodosum is noted down. Absence of erythema nodosum. Extrapulmonary features like splenomegaly, lupus pernio, which is a rash or the forehead and eyebrows. Chest X-ray showing 3rd or 4th stage disease. These patients have poor prognosis. Black people, if they get sarcoidosis, they have poor prognosis. Cardiac or neuro environment, they have poor prognosis. Chronic hypercalcemia also have poor prognosis, and nasal mucosa involvement also lead to poor prognosis. Two variants, one is Lofgren syndrome, another is Halford syndrome. These are two variants of the sarcoidosis which we'll discuss in some other lecture. Association, it has association with Mikulicz syndrome, which we also discuss in some other lecture. Thank you.